Doctor, can you tell us what are the range of eye care services that you provide in the hospital?
Thank you very much. And first of all, I would like to extend my deep gratitude to your team and for this wonderful opportunity to be part of this wonderful program. So to talk of briefly about the eye services that we provide here at Eastern Regional Referral Hospital. First of all, I think I should mention about the staffing of the Department of Ophthalmology of our hospital. At the moment, the Department of Ophthalmology is staffed with the 3 eye specialists, with the 3 ophthalmologists and 2 optometrists, and we have 5 ophthalmic assistants, and in total we are 10 of us providing a wide range of services related to eye care. So in terms of the services, we provide a comprehensive eye care services at our center, starting from the basic outpatient consultations, screening for cataract, screening for diabetic retinopathy, hypertensive retinopathy, screening for retinopathy of prematurity, and diagnosis and management of a wide range of eye-related conditions such as conjunctivitis, uveitis, and glaucoma. And we also perform various surgeries, including cataract surgeries, pterygium surgeries, eyelid surgeries, and further we have like outreach community services such as school health screening, monastic center screening, and surgical eye camps that we conduct on an annual basis to reach out to our community at large.
Yes. So doctor also mentioned about the staffing situation in the hospital. So do you think the hospital is well staffed, or are the current staffing situation adequate for the district's needs?
Yes, given the amount of patients that we see,
yes,
from our past data, we are seeing at around like 13,000 patients in a year, yes, on an average of like 50 to 60 cases on daily basis.
Yes.
And we perform a lot of surgeries. From our past data, we have performed like more than 600 surgeries, out of which the majority are cataract surgeries. And we believe the current workload is suitable for the current staffing pattern of this hospital. And we are not just providing services at our hospital, since Mongar Regional Referral Hospital is the only center with specialist eye care services. So we are responsible to provide the eye care services to the whole of the eastern region, and that we current staffing pattern, I think, is it's suitable.
Yes, that's a good news to know that. So doctor, with the range of services that you mentioned, what are some of the common eye conditions that you treat in the hospital?
Coming to the common eye conditions, as is in other parts of the world or other regions, the common things that we see are the refractive errors, which is meaning that persons who require to wear glasses.
Yes.
And the other thing that we commonly come across and manage are cataract. Cataract is age-related eye conditions, but it is one of the leading cause of vision loss in our country, and that is also one of the common things that we deal with in our day-to-day practices. And of late, we have been seeing lots of patients coming up with inspecific eye symptoms such as burning sensation, blurring of vision, itchiness, excessive tearing, And we believe that includes all age groups, starting from kids to the elderly people. So that we believe that it might be associated with the screen time, since with the rise of the use of electronic gadgets, I think that is playing a role in the eye issues. Yes. Though we do not have solid data to substantiate these findings, but from our day-to-day clinical practice and our clinical observations, we see lots of such cases.
So, doctor mentioned that one of the common eye condition that you encounter in your practice is cataract, and you also mentioned that it is a kind of degenerative eye condition. So, are there any other causing factors that leads to cataract?
Basically, cataract is an age-related condition. Usually, it occurs in individuals above 50, 60 years of age.
Yes.
But it's not exclusive of age.
Yes.
There are other conditions which can cause cataract, such as there are cataracts which are present at birth, which is called congenital cataract, and the cataracts which are caused by trauma, they're called traumatic cataract, and some forms of diseases like, for example, diabetes. Diabetes can also cause the formation of cataract, or it can hasten the process of cataract formation, and certain systemic conditions can also predispose a person to the cataract formation. And other important thing is, since our people who are working more outdoors, exposed to the sun rays, UV rays, these people, this can also be a contributing factor for cataract formation.
Yes. So, doctor, are there also specific age groups or communities that are more vulnerable to specific eye condition in the region?
As I've just mentioned, cataract being the leading cause and other being the refractive error, that occurs mostly in the age group of 50 years and above. And of course, the children are also at risk of undetected refractive errors, yes, which can significantly impact in their growth and development. And if they are in school-going children, it can impact their performances in the school. And at the same time, since in the eastern region and in the country in general, majority of our people are farmers. Their work is has certain risks to their ocular health as well, because we see lots of cases of work-related injuries, especially farm worker who gets their eye injured because of the work. Yes. That's work-related ocular trauma, which is also one of the common cases that we come across in our daily practice.
Let's go back to the treatment for cataract. I missed out on the congenital cataract treatment part. So what are the interventions that are available here in the hospital for congenital cataracts? Is it same for the adults, like they have to get it done with surgery, or are there any other treatment options?
Yes, in coming to the management of the cataract in children, the congenital cataract is quite different from the cataract of the adult cataract, in the sense that the children with cataract needs to be treated as quickly as possible, yes, as early as like 1-2 months of age. That is because if that cataract is left like that, it can cause something called lazy eye. In some scientific terminology for that is amblyopia. So it will hamper the normal growth and development of the visual system of the child. So in our setting, we do not perform the cataract surgery for babies, like small babies, and we have subspecialty services available at our National Eye Center in Thimphu, and we do refer the kids as soon as possible to 𝗂𝗵𝗵𝗂𝗵𝗂𝗧 for further management, for surgical management.
Yes. So on that note, can doctor please emphasize the importance of screening for children and elderly? How is the process done here?
Yes, screening is very critical. For any disease, screening plays a very vital role. Similarly, in the screening of, like for example, cataract, as you have mentioned, our eye camps, we perform eye camps on an annual basis. What we have noticed is the success of that camp,
yes,
the volume of surgeries that we perform basically depend on the effectiveness of the screening work that we do. So meanwhile more screenings we do, we pick up more cases of cataract and address them on a timely basis. Because cataract, if left untreated for a long period of time, can lead to certain conditions, certain complications that can permanently lead to the vision loss.
Yes. How is the screening done for children?
We are in the process of integrating the screening services, especially the pediatric screening services, into our basic healthcare system.
Yes.
And the screening now is not fully implemented, but the MCH book that our mother children have, it is incorporated into that book, and very soon our healthcare workers working in the grassroots, in the BHUs, will be able to screen and pick up the cases early and do the timely referral.
Yes, doctor. So, doctor, have you seen any trends or increases in the specific eye conditions in the region?
Yes, the eye conditions, as I have mentioned earlier, the patients coming with the digital eye strain.
Yes.
I personally feel that it is on rise, since we all know that invariably we are exposed to the digital gadgets in the recent times. And we do not have the solid research and data to substantiate these findings, but we do feel that it is on rise. And on the other side, we have also recently seen rise in the patients with diabetic retinopathy. I think that represents a broader trend of rise in prevalence of diabetes and other non-communicable diseases in our population.
So, doctor, so these conditions that you mentioned are highly preventable. So, what are the measures that people can take to prevent these eye conditions? Maybe let's start with the digitally related eye conditions that you mentioned.
So, since the time has changed, and now we are practically living in digital age, and we are exposed to the digital gadgets, and every time we are in front of screens, LCD screens, be it a phone or be it a laptop or computer or TV. So what our people have to be aware of is that this can cause issues to your eyes. Basically, something called digital eye strain. It also causes dry eye syndrome, because all are related. So what I recommend to prevent the digital eye strain or dry eye syndrome or dry eye disease is that people who are using or who have to use gadgets at their work or otherwise, there's something called 20-20-20 rule, which is very doable, which is very practical. What it says is, for every 20 minutes of screen time, you have to take break, look at something farther than 20 feet, and then you blink, close your eyes, and take rest for 20 seconds, which is very much doable. And this will prevent dry eyes, this will prevent digital eye strain, and this can widely improve your productivity at work, and it can, of course, prevent any further complications.
Also, doctor, how can we prevent the risk of developing NCDs-related eye conditions, like you mentioned, diabetes, retinopathy, hypertension? Is it hypertension? Sorry,
yes,
hypertension, retinopathy. So, what are some of the preventive measures that people should take?
Keeping in mind the rising trend of the non-communicable diseases, which includes hypertension and diabetes, our people should be aware of the fact that the diabetes and hypertension can cause a severe damage to your eyes, and the way to prevent it is to get regular eye checkups. You have to get your eye checked by an eye specialist at least once in a year. And if you have the disease, for example, if your eyes have already started the diabetic retinopathy, for example, then depending upon the severity of the diabetic retinopathy, the severity of the damage that it has caused to your eyes, so we program, schedule more frequent follow-up visits, and if any complications arise, such as a person might need laser therapies or injections into the eye, then in such cases we do refer to the eye center for all the subspecialty care.
So, doctor, on that note, how's the coordination of cross referrals when there are cases of NCDs related eye conditions?
So nowadays, because the NCD, people who are suffering from hypertension, diabetes, they generally are seen by medical specialists or our general duty medical officers, GDMOs, and now they do refer the patients with hypertension and diabetes for fundoscopy. The procedure is called fundoscopy, that basically involves the examination of the backside of your eye, it's the retina, where the damages usually occurs. And there is a separate unit for NCD in our hospital. We also get patients referred from NCD clinic to the ophthalmology department for the fundus examination to rule out any diabetic or hypertensive changes in these patients.
Yes, doctor. So let's talk about the facilities here in the hospital, especially for eye care. Is the hospital well equipped with recent infrastructure or screening, diagnosis machines? Are they available?
Well, I should say that our center is relatively well equipped. With we have slit lamps for eye examination. We have diagnostic facilities like such as fundus camera, ultrasound services. We have screening machines that are used to screen the retina, the back of the eye. It's called OCT machine. And we also have YAG laser machine, retinal laser machines, and of course the operating microscopes and so on. And we also have screening tools for glaucoma, like tonometry to measure the eye pressure, and perimetry to check for any visual field defects caused by glaucoma.
Yes. So, doctor, are there any common eye conditions that you have to refer to the National Referral Hospital?
Yes, we always do have the complex cases like retinal detachment. for example, and advanced diabetic retinopathy, which requires laser treatments and injections, and advanced or uncontrolled glaucoma, whose eye pressure cannot be controlled with drops and other medications. We refer for surgeries, and we also refer patients with nasolacrimal duct obstructions for surgeries to the National Eye Center, and pediatric surgeries, squint correction surgeries, eyelid, for example, especially eyelid drooping, it's called ptosis surgeries, and patients who require corneal transplant, eye transplant. We do refer to the National Eye Center, where more advanced subspecialty services and more advanced equipments are available.
So, doctor, basically, like eye treatment is categorized into two, like cosmetic and reconstructive. What's the emphasis is on currently? Is it just for the reconstructive, or do you also perform cases on cosmetic?
As you have mentioned, yes, there are certain surgeries related to eye, which come under the category of cosmesis for the reason of cosmesis. For example, eyelid surgeries to make a double eyelid. That's purely cosmetic for cosmetic reasons, and even the refractive surgeries. We do not have those facilities in Bhutan, but still, the refractive surgeries are also not. As you mentioned, reconstructive surgeries. That comes in the line with the main management of the condition. In the case of the cosmetic surgeries, we do not perform much, but except for patient coming with, for example, pterygium.
What's
Pterygium is a condition in which there is an extra growth in the eye. Extra growth, which encroaches onto your cornea. So some people come with the reason for removal of that additional tissue growth for the reason of cosmesis. So we do perform such surgeries, but beyond that, we do not perform the lead surgery for cosmesis, and neither we do give the injections. Like you might have, of late, people are going for Botox, botulinum toxin injections, which also come in the ambit of ophthalmic care. Ophthalmologists to give the Botox injection, but we do not have these facilities here. And basically, we are focusing on the curative side. Yes, we are performing more of the cataract surgeries, which is the leading cause of visual loss, as I mentioned earlier. And other common surgeries that we perform are pterygium. Yes. Of course, those pterygiums that we perform are not for cosmetic reasons. The pterygiums, which are like advanced pterygiums, which are visually, significant, and which is giving trouble to the patients, causing like pain, redness, and things like that. So we do perform surgeries.
So do the patients undergoing such surgeries, do they have to pay a minimal fee?
No.
Yes.
It's totally free, and the Bhutanese in total will have to be very grateful to our monarchs, visionary leaders, because of whom all the health facilities, all the health services are free of cost. For example, a cataract surgery, if it's performed in other countries, it costs thousands of dollars, or for example in Nepal or India, it's charged like in between 15 to 20,000, for example, Ngilcham. So it is in our settings, it's totally free.
Yes. As the doctor mentioned that the staffing situation here is I think, very positive of what you have said. Then you also mentioned that the facility is well equipped with the recent infrastructures. So are there any other limiting factors in providing quality eye care to the people in the region?
Basically, we do have all the basic needs to cater the basic eye care needs of our region and our people. And of course, there are rooms for improvement always. And for example, that is, I believe, is in the plan. For example, cataract surgery. Cataract surgery, the surgery that we perform here is called manual small incision cataract surgery. It's called SICS, and it's a very good, effective surgery. But in other parts of the world, there are other ways of other technologies to address cataract. They perform something called phacoemulsification. They do cataract surgery using a machine, ultrasonic machine called phaco machine. We do not have those facilities yet, and in the near future, we believe with the leadership of our head of department and all other senior consultants who are working in National Eye Center and across the country under the Department of Ophthalmology, we'll look forward to establish phacoemulsification as the standard of care for cataract surgery.
Yes, Doctor, I think that brings us to the end of today's session. And if there are anything that you want to get it out there to our viewers, maybe something that I have missed out from the questions that I asked, then please.
So nothing much, but so I would like to emphasize that in Eastern Regional Referral Hospital, we have all the basic specialty cares and services related to your eye care, and I would like to reach out to our public to please come and avail and make use of those services.
Thank you so much, Dr. 𝗘𝗀𝗏, for your time. And I think this episode was helpful in understanding the importance of eye health and the services available here at the Eastern Regional Referral Hospital. And I'd like to thank you again for your time and your insights.
My pleasure.
And that brings us to the end of our session. Thank you so much for watching. Until next time, take care. Goodbye.
Eurovision di samling nalu ngien chada luyang gi tendur pomcho chi ma chulu chik tong kupcha